Pembrolizumab, a newly developed drug targeting melanoma. So what is pembrolizumab? Pembrolizumab is the generic name of the trade drug Keytruda. It is immunotherapy medication administered to shrink tumors and assist those patients with advanced melanoma, which is a type of skin cancer on parts of the body that have been overexposed to the sun. Pembrolizumab is a systemic treatment for cancer as it activates the body's immune system to fight off the cancer. Patients are given pembrolizumab intravenously every 3 weeks and can take 30 minutes for the dose to be completed. So let's have a look at how it works in the body. Tumors invade the immune system through the programmed cell death 1 pathway. The PD-L1 and PD-L2 ligands on tumors then binds with PD-1 receptors on T cells to inactivate them. So how does pembrolizumab fight against this? As it is a humanized PD-1 blocking antibody, it works by directly blocking the interaction between the PD-1 receptor and its ligands. By blocking the PD-1 receptors, pembrolizumab reactivates tumor-specific cytotoxic T lymphocytes in the tumor microenvironment and re-stimulates anti-tumor immunity. We evaluated 2 distinct clinical trials. The Melanoma Institute in Australia performed the first trial of its kind in 2015. The aim of the study was to compare 2 effective immunotherapies, which were pembrolizumab and ipilimumab, and how these impact the rate of survival. Results were in fact positive, as the antibody pembrolizumab was effective in prolonging survival. To be more specific, after 1 year, there has seen to be 74% survival rate, a 16% greater chance of survival than if the patient was administered ipilimumab. The second trial, undertaken in 2014 involving 411 patients, focused primarily on whether pembrolizumab was effective in treating patients with unresectable or metastatic melanoma. Outcomes were as hypothesized, as the drug was deemed safe and effective. However, despite proven efficacy endpoints, there was reported to be serious adverse reactions in less than 2% of the patients, which resulted in renal failure, cellulitis, pain, and dyspnea. The discontinuation rate associated with these adverse reactions was 6%. Now let's look into the differences between pembrolizumab and the initially used ipilimumab. Both the drugs are administered intravenously, however at differing doses and durations. 200 mg of pembrolizumab is infused over a 30-minute period every 3 weeks, and ipilimumab, 10 mg per kilogram, is administered over 90 minutes every 3 weeks for 4 doses. From the clinical trials, it was concluded that 28% of patients on pembrolizumab and 14% of patients on ipilimumab every 3 weeks had not progressed with the disease. When comparing the toxicity and survival rate, pembrolizumab has a greater survival rate and produces fewer side effects in comparison to the immune-related side effects experienced by ipilimumab. Thus, the introduction of pembrolizumab as a drug for the immunotherapy of melanoma is more effective. According to clinical guidelines, pembrolizumab is a preferred single agent for metastatic or unresectable melanoma. It is used as first-line therapy and a second-line therapy for the disease progression for patients with performance status therapy where monotherapy is not used previously. It is also used as reinduction therapy for patients with performance status 0 to 2 who experience disease control initially, but experience progression after 3 or more than 3 months of discontinuation of the treatment. The use of pembrolizumab gives insight into issues such as cost, adverse effects, contraindications, and social impacts. The cost for a 100 mg vial is $4,381 and per dose is $8,762. Pembrolizumab can cause the immune system to attack normal organs and tissues in any area of your body, resulting in decreased appetite, hair loss, shortness of breath, severe muscle weakness, and the list goes on. When administered, drugs such as corticosteroids or immunosuppressants should be terminated due to suspected interferences. Additionally, it is advised that pregnant women should not take this drug as it increases the risk of miscarriage. Finally, this immunotherapy reduces the inability for normal body processes and therefore limits the ability of social interactions with family members or friends. This creation of a successful PD-1-based therapy has been noted as a significant breakthrough within the immunotherapy field. The further development will see the potential of pembrolizumab to treat more than 30 tumor types in the years to come.